Good evening. My name is John Dignan, Superintendent of Wayne-Westland Community Schools. Thank you again for joining our board meeting this evening. We're going to have presentations with recommendations as part of our Return to Learn instructional plan. First off, this overview is on the Michigan Safe School report that came out on June 30th, 2020. Michigan Governor Gretchen Whitmer released the Michigan Safe Schools, Michigan's 2020-21 Return to School Roadmap. This roadmap outlines safety protocols that are required and must be implemented by all Michigan schools that serve students in grade pre-K through 12th grade. As we've come to expect during these challenging times, circumstances evolve and change frequently. With each twist, we adjust our practices and procedures to reflect these changes. We have worked diligently to prepare our Return to Learn roadmap that prioritizes opening and operating safely and providing our students with the highest caliber learning environment, whether in person or distance learning. As we've learned since March, the circumstances and responses to COVID-19's public health emergency are regularly changing. On August 20th, the Return to Learn also changed. Governor Whitmer signed House Bill 5913 into law as Public Act 149. This bill states that in order to receive state aid for the 2020-21 school year, districts must provide for instruction under an extended COVID-19 learning plan that has been approved by the local school district. The plan does not replace the district's COVID-19 preparedness and response plan that we turned in this summer. It is an additional plan that includes new assurances and sections on educational goals, instructional delivery, grading, and equitable access. The district's extended continuity of learning plan with educational goals was written for all students in all subgroups and was approved by the Wayne-Westland Community School Board of Education on September 14th. It was turned into Wayne RESA on September 15th and approved by the Michigan Department of Education in late September. As we've learned again since March, the circumstances and responses to COVID-19's public health emergency are regularly changing. To that end, committees have met, discussed, and collaborated to plan and prepare for our new educational reality. In this slide, we'd like to share the COVID-19 pandemic orders that have impacted Michigan schools. As you can see, school-related executive orders, there are many. Some had been rescinded, but again, I just want to talk about how we got there. Governor Whitmer's authority was based on two separate laws when she set these executive orders. The first was the Emergency Management Act of 1976, and then the Emergency Powers of Governors Act of 1945. The Michigan Supreme Court in October determined the governor did not have the authority to issue or renew the executive orders related to COVID-19's pandemic under the Emergency Management Act of 1976 after April 30th, 2020. They also stated the governor did not have the authority to exercise the emergency powers of the Governor Act of 1945 because it unlawfully delegates legislative powers to the executive branch in violation of the Michigan Constitution. This slide helps to summarize the state of executive orders in lieu of the recent Michigan Supreme Court ruling striking down current executive orders from the governor. The reason I'm sharing this is because the Return to Learn legislation is still in place and the current efforts to ensure safety should continue unless there's new direction from the state. This slide, the COVID-19 pandemic impact on Michigan schools, addresses the Michigan Department of Health and Human Services stepping in after the Michigan Supreme Court struck down the governor's executive order in October. This meeting we're having today was impacted because of the Open Meetings Act that was impacted by this decision. The Open Meetings Act and board meetings, again, the Michigan Senate, House, and Governor approved Senate Bill 1108 addressing electronic meetings under the Open Meetings Act, where public bodies will be permitted to meet remotely by telephone or video conferencing under specific circumstances, including when a statewide or local state of emergency is declared and there is a risk to the personal health or safety of the board members or the public. We are meeting as a governing body this evening from John Glenn High School. We're live streaming the meeting. Importantly, any board meeting held between April 30th, 2020 and any board meetings held up until December 31st, 2020 can be held electronically for any reason, and public bodies will be permitted to hold electronic board meetings due to a state of emergency until the end of the calendar year 2021. Separately, until the end of the calendar year 2021, board members with medical conditions may participate remotely in the same way members absent due to military duty are currently accommodated. This shows how fluid of a process this has been. Again, Senate Bill 1108 allows public bodies to meet remotely through January 1st, 2021, starting again at March 18 under any circumstances. For the entirety of 2021, if a board or council member has a medical condition, there's a state of emergency, or because of military duty after December 31st, 2021, only in circumstances of accommodating members absent again due to the military duty. Guidance. The Wayne-Westland Community School District has developed training in accordance with our Michigan Safe School Return to School Roadmap. We are also cooperating and seeking guidance from the Wayne County Health Department regarding implementing protocols for screening students and staff. The MDE approved our extended continuity of learning plan from the start of school. The COVID-19 mitigation plan for the Wayne-Westland Community Schools was reviewed and approved by the Wayne County Public Health Division on October 9th. This review has determined that the Wayne-Westland Community Schools COVID-19 mitigation plan meets the standard of the mitigation measures as detailed in the Michigan Safe School, Michigan's 2020-21 Return to School Roadmap. Thanks again to all the committee's employees that had a hand in the development of both these documents. Now we are going to move into our dashboard criteria and data. Dashboard criteria. We use district, county, state level dashboards when we are looking at data. So we look at the state level monitoring, the local level monitoring, the district COVID-19 dashboard, state dashboards, the CDC information and data, stakeholder preference, and the ability to implement our preparedness plan. The slide here deals with the dashboard criteria for our district dashboard. This information can be found on our Return to Learn website, on our local school district website. Again, this helps to detail any new positive COVID-19 cases and quarantine cases along with the location of the identified case. We post this to our dashboard within 24 hours of the reported occurrence. If the reported number includes a case associated with your specific school, you will receive a letter from the district. Please note, due to HIPAA regulations, we will not be releasing information about who the affected person is and or whether or not they're a student or staff member. Again, you can see an example of what the chart looks like on our website. It deals with Wayne County, and again, this is something that is found on the Wayne County Health Department website. They use a rating system which is state mandated, and again, as you can see, they have different risk levels from low risk all the way to risk level E. Wayne County Health Department chart will show level E is the highest risk. Much of the county is in the same situation. Many of the county right now is at level E. Wayne and Westland communities are at risk level D. Again, this information or data is over a 15-day period ending on October 20th, 2020. The Wayne County Community Spread Risk Level, this is a measure of the risk of a community spread based on COVID-19 case data collected from the Michigan Disease Surveillance System database. It is a weighted factor based on the average number of cases per day, normalized to a rate per 1 million population, the 4-week plus or minus trend rate, and the county's overall average positive rate is calculated by the state of Michigan. If the county positive rate is less than the normalized rate per million population, the positive rate is not factored in. This follows the Michigan Department of Health and Human Services guidelines. The data in this analysis represents the 42 non-Detroit communities in Wayne County. This measure is based on a 15-day rolling average to the date noted. And again, that is October 20th. As you are aware, the number of COVID-19 cases in Wayne County continues to rise. Currently, Wayne County is at an overall community spread risk level of E. This is the highest risk level on the state's community risk determination level. In addition, many communities have seen the risk levels move from low or moderate risk to high or very high risk in just 1 week's time. County health officials share our concerns about this increase, and this information is intended to provide short-term guidance that will help school administrators and board members make the best and safest decision for all students, teachers, staff, and communities. This dashboard criteria again shows you the county. Again, the risk levels show you in chart form. The increase in risk level from last week to this week is substantial. It is being driven by a near doubling of positive cases in Wayne County over that period, and more specifically, the last 3 days of last week. It is too soon to definitely say whether this trend will continue, but COVID-19 cases across Michigan are on the rise, and the percentage of positive tests from the COVID-19 continues to grow. This dashboard may be used to compare data and trends from other Michigan counties is selected. That's why a lot of different people use this as part of their analysis. I want to show how you kind of read this chart. So if you see the red box that secludes the chart at the top, it will show you cases. Again, these are broken into 2-week windows, and you can see September 6th cases were about 92.6 a day. Looking to October 18th, it has risen to 126. So again, it gives you an idea of where cases are at. You can see a dip here around September 20th, and again, that's where we were starting to plan back in our in-phase learning. But as you can see, over a few weeks, the number of cases has really risen. Same thing with the red box. It takes you through 2-week spans of where cases are at within a specific county. In this case, this is Oakland County, and you can see in September to where they're at right now in October, they've almost doubled the amount of cases within their county. Washtenaw County, you can see the rise in their cases as well. Even though it isn't in regards to numbers, again, you can see they've almost tripled from September to October. I'm going to show you a pretty interesting fact, and part of the reason, just a few weeks ago, the University of Michigan announced quarantining some of their students, and you'll see this visually in another chart. Ingham County, where Michigan State University resides, shows again, and I try to highlight there that the Michigan State stay-at-home order. Michigan State, coming out of the summer, had about 1,500 cases of COVID-19, and they ended up quarantining for a number of weeks to kind of mitigate the numbers and the spread of the virus on their campus. You can see by the stay-at-home order what happened to the number of cases. We come back to the Wayne County dashboard, and again, this chart just shows you in 2-week blocks how to kind of read the chart or the graph above. Again, the Wayne County Health Department community spread risk level. This is a measurement of the risk of community spread based on COVID-19 case data collected using, again, the Michigan Disease Surveillance System database. It's weighted on a number of factors, which I mentioned at the start of this. And again, we get these reports from the Wayne County Health Department. We started in October to get them once a week, but now we are going to start to get them bi-weekly. Again, this measure is based on a 15-day rolling average to the dates noted above. Dashboard criteria that the state uses. It must be acknowledged that the pandemic is not over and that its course remains largely unpredictable. It is possible that state officials could at one point determine that a region or regions have to shift back into phase 3. Again, right now we're in phase 4, but the Michigan Department of Health and Human Services still can determine the phases that we're in. Again, if you get some good resources that families can look at, the Wayne County Health Department virtual binder and related FAQ can be found on their website. It's also on the Wayne-Westland Community School District webpage in the Return to Learn section. There's a lot of good information there that is pretty updated, that gives you real time and accounts and statistics on where we are at as a county. They cannot do specific school districts, but they can do communities, so you get a pretty good idea of where COVID-19 is at in community. I just want to say COVID-19 outbreaks are usually defined as 2 or more cases with a link by place and time that indicates a shared exposure. On Saturday, the state reported 3,338 new cases and marked the state's highest single-day increase in COVID-19 cases since March 13th. The Wayne-Westland Mitigation Plan. Our plan includes 11 mitigation strategies for reopening safely. These are personal protective equipment, PPE, spacing, movement, access, hygiene, screening students and staff, busing and student transportation, food service, gathering, extracurricular activities, testing protocols for students and staff, responding to positive cases, cleaning, athletics, medically vulnerable students and staff, and responding to positive tests among staff and students. The district school plans should score 80 to pass the Wayne County Health Department mitigation threshold. Our plan was approved by Wayne County Public Health Division in October. The Wayne County Health Department has adopted a scoring methodology to evaluate schools' readiness for a safe return to school. If Wayne-Westland Community Schools implements minimum of 6 feet social distancing, our estimated score was 100 out of 100. If Wayne-Westland Community Schools implements a 4 to 6 foot social distancing, our score is 98.5 out of 100. Again, the Wayne County Public Health Division will monitor compliance with plans and also any potential outbreaks within school districts. Strategies in place in our schools. According to the county, both the number of COVID-19 cases and the positivity rate in Wayne County are increasing significantly over the last 2 weeks. While we've not seen any new cases in our district, we are watching the community cases closely and actively gathering guidance from the Wayne County Health Department so we can continue to put school safety first. At the same time, as we have shared before, school safety is a community effort. We know that in-person classes are the best way for our students to learn and benefit students' social, emotional, and academic growth, and we are doing all we can to open our school buildings for in-person instruction. However, we can only control the mitigation practices and safety measures in place in our school buildings. We rely on our entire school community to work together to prevent the spread. We encourage you to continue to have frequent conversations with your children about COVID-19 safety. This includes wearing cloth face covering or a mask when in close proximity with others, practicing frequent hand washing, staying home when sick, and watching for potential symptoms of the illness. We know it's hard, but when possible, stay away from family gatherings and other indoor activities that increase the spread of COVID-19. We are working closely with the county to determine next steps, and we will keep you updated as the situation progresses. CDC guiding principles and district processes. The CDC guiding principles for return to school. The more people a student or staff member interacts with, the longer that interaction, the higher the risk of COVID-19 spread. The risk of COVID-19 spread increases in school setting as followed. The lowest risk is students and teachers engage in virtual-only classes, activities, and events. More risk, small in-person classes, activities, and events. Groups of students stay together with the same teacher throughout or across school days, and groups do not mix. Students remain at least 6 feet apart and do not share objects. And again, an example of this could be a hybrid model. Highest risk is full-size in-person classes, activities, and events. Students are not spaced apart, share classroom materials or supplies, and mix between classes and activities. This would be considered a full traditional school setting. The Wayne County Health Department has stated if COVID-19 cases continue to increase and the community spread risk level continues at its highest level, the Wayne County Public Health Division will issue stricter guidelines that can include suspension of in-person classroom learning in communities with sustained high levels of COVID-19 cases. The Wayne County Public Health Division will continue to work with Wayne-Risa and local school districts to monitor the case counts and risk levels in order to provide school districts with appropriate guidance to ensure our students, teachers, staff are safe and healthy. According to positive tests, we've created by the district, and again with approval with Wayne County Health Department, a step-by-step guide of positive COVID-19 cases in our buildings or in different scenarios. Again, this will come out in a parent and guardian handbook that we will send to all community members as well as staff. Again, I want to kind of harp in on one of the things that the CDC came out with last week. Prior to last week, the CDC's stance on close contact, or how you would define a close contact, would be for somebody to be within 6 feet of a person for 15 consecutive minutes. The CDC last week came out and changed that to say a close contact is somebody that you're around within those parameters for 15 minutes over a 24-hour span. The Wayne County Health Department is still using the standard of being within 6 feet of a person for 15 consecutive minutes when they investigate a possible COVID-19 case. This has changed again. So just having conversations with the Wayne County Health Division and Wayne-Risa, the new CDC guidance was released last week. The Wayne County Health Division has concluded that the provision about tracking cumulative minutes is impractical and will lead to errors. So the Wayne County Health Department has directed us as school districts to continue to use the close contact definition that refers to being within 6 feet of somebody for 15 consecutive minutes. The Wayne County Health Department will use their contact tracing systems to expand upon that definition should the facts and circumstances of an individual case warrant it. I hope this helps clear up any confusion from the CDC announcement from last week. I want to reiterate, COVID-19 outbreaks are defined as 2 or more cases with a link by place and time that indicates a shared exposure. This typically means 2 cases in a location from 2 individuals from separate households. COVID-19 communication. We're doing everything possible to keep our students and staff safe. Wayne-Westland Community Schools will continue to follow health department guidance for contact tracing, room closures, and cleaning, and any necessary quarantines. Communication will occur within the buildings, district, and community according to the recommendations from the Wayne County Health Department. We have designated space for students experiencing COVID-19 symptoms whenever we do come back to in-person learning. Again, these rooms have been designated as COVID-19 quarantine rooms for students and will be manned by nurses, so we have medical professionals that are able to work with our students. Again, for students who may be experiencing symptoms that appear related to COVID-19, a room has been designated for them to wait in until a family member arrives to pick them up. The room is disinfected after every use and ensures that we are doing everything possible to reduce possible exposure in our schools. Again, communication of COVID-19 cases. We will communicate entire school. Community will be notified. District contacts emailed first. School-wide notice will be emailed. The Wayne County Health Department will be notified. Privacy rights for individuals. Our district and school cannot provide information that would identify the person to the general public. Your understanding is greatly appreciated. Self-screening. Before your child leaves in the morning, we are going to ask parents and guardians to ask 3 simple questions and check for these symptoms. In the past 10 days, has the student tested positive for COVID-19? In the past 14 days, has the student come in close contact with someone who is tested positive for COVID-19? Does your child have any of the following symptoms? And you can see fever, chills, vomiting, loss of taste or smell, muscle or body aches, cough, shortness of breath, or difficulty breathing. We ask when we do return to in-person learning that these self-screens take place every day. And if the student shows any of these symptoms, we ask that you keep them at home. Parents have a part in this and are expected to partner with us. We are all in this together. If we are going to cut down the mitigation of this disease, we must have consistent practices. It is critical that all of our community members follow appropriate safety protocols to keep themselves and those around them safe. These steps include the use of personal protection equipment, the use of hand sanitizers and disinfectants, social distancing, self-screening, and staying home if you or your student does not feel well. We need everyone working together to keep our school community safe. District survey data. Planning purposes, we sent out a survey to all staff. And should the board approve the plan to return with a hybrid in-person learning on November 9th, 2020 for pre-K through 6th graders, or January 19th, 2021 for 7th through 12th graders, do you intend to continue working in your current position? As you can see, the blue symbolizes continue working in your current position is at 74.4%. Again, we surveyed our staff again, and these are the findings. This equates to the whole staff, so it's not just instructional staff, and I want to make that perfectly clear. As you can see, request a leave of absence is in the red, and that's at 9.1%. We asked a question to our parents and guardians if we were authorized to resume in-person instruction for pre-K through 6th grade on November 9th, 2020 and 7th through 12th grade on January 19th, 2021 with proper safety precautions in place. Do you intend to send your children back to school? We had over 2,885 responses, and of that, 66% said yes, 34% said no. Again, this survey closed on October 25th, and 66% of parents said they would send their student to in-person instruction. District preparedness plan criteria. Preparedness plan and criteria. Some of the criteria that we have to follow is personal protective equipment, PPE, hygiene, spacing, movement, and access, screening students and staff, testing protocols for students and staff, and responding to positive cases, responding to positive tests among staff and students, food service, gatherings, extracurricular activities, athletics, cleaning, busing and student transportation, medically vulnerable students and staff. As you can see, there's a lot there. This is part of the extended continuity learning plan. We send this out via video on October 12th to all stakeholders. We will have a parent handbook and also provide videos that will be done for every specific criteria that I listed above. On October 9th, the COVID-19 mitigation plan for the Wayne-Westland Community Schools was reviewed by the Wayne County Public Health Division and approved. Again, this review determined that the Wayne-Westland Community School COVID-19 mitigation plan meets the standards of the mitigation measures as detailed in the Michigan Safe School Return to School Roadmap. Therefore, this mitigation plan is considered approved for implementation by the Wayne County Public Health Division. Personal protective equipment, better known as PPE. Mitigation measures. What? Face coverings. Who? All staff, bus drivers during route, pre-K through 12th grade students. Where? Classrooms, hallways, common areas, on buses. Exemptions. During meals, or if deemed medically unable to tolerate a facial covering. Students with significant disabilities preventing the use of facial coverings are referred to forthcoming guidance from the Michigan Department of Education. It's children aged 2 and under. Face coverings provide an essential shield to mitigate the spread of COVID-19 from spreading from child to child, adult to child, child to adult, or adult to adult. Face coverings will be used by all individuals in schools at all times, except where I listed the exceptions. This includes hallways, indoor common areas, and classrooms. The only exceptions will be during the meals or taking a water break. When removing the face covering to eat, they should only be touched by the strings, and students should be careful not to rub their eyes, nose, or mouth. If there's an underlying medical condition that impacts your child's ability to wear a face covering, please contact your school principal. Here, the personal protective equipment requirements is kind of laid out in each phase. Red symbolizes phases 1 through 3, where school would be closed for in-person instruction. This would be made by the Michigan Department of Health and Human Services. Phase 4 and 5 is yellow. Again, we're in phase 4. Facial coverings required for all staff and students to wear. Facial coverings pre-K through 12th grade. In phase 6, there's no facial coverings. Hygiene procedures. Some mitigation measures that we will follow. Provide adequate supplies to support healthy hygiene behaviors, including soap, hand sanitizer with at least 60% alcohol for safe use by staff and students, paper towels, tissues, signage reinforcing proper hand washing techniques, teach and reinforce hand washing with soap and water for at least 20 seconds, and order the safe use of hand sanitizer that again contains at least 60% alcohol. Set up portable hand washing and or hand sanitizing stations throughout schools. Systematically and frequently check and refill soap and hand sanitizers. Students and teachers must have scheduled hand washing with soap and water every 2 to 3 hours. Educate staff and students on how to cough and sneeze into their elbows or to cover with a tissue. Used tissue should be thrown in the trash cans and hands should be washed immediately. Again, if you look up, phases 1 through 3 in the red, schools closed for in-person instruction. Phases 4 and 5 in the yellow, requiredly and strongly recommended. Classroom supplies provided to support healthy hygiene, training, frequent hand washing breaks, limit sharing of supplies. Phase 6, classroom supplies remain intact and continue to promote healthy hygiene practices. Spacing, movement, and access. Again, the red symbolizes school closed for in-person instruction. Phase 4 and 5, Hybrid classes, spacing desks 4 to 6 feet apart. 6 feet is strongly recommended. All desks facing forward, staggered passing. Again, staggered passing is talking at the secondary level. Staggered passing time amongst classes. Limited use of common area and limited hallway movement. Phase 6, there are no limitations on spacing, movement, and access. If you look on the right-hand side, keep space between you and others. It shows when outside, the 6 feet distance in the classroom, and then again on the bus. Student, staff, and testing protocols. Again, phases 1 through 3 in the red, schools closed for in-person instruction. Phases 4 and 5, students and staff, self-health checks. Follow guidelines from the Wayne County Health Department. Designate quarantine area and train staff for ill students and staff. Communication plan with parents and staff and the health department for ill students and staff. Phase 6, normal illness protocols will be into play. Food service gatherings and extracurricular. Phases 1 through 3, food distribution happens via pickup, which we are using right now at our specific buildings. This year, we have food pickups at each of our buildings, and again, we've created 2 new pickup times. One at Wayne Memorial High School for anybody in the district from 5 to 7, and then another one at John Glenn on Wednesdays from 6:30 to 8:30 in the morning to help families that are working. Again, all inter-school and after-school activities will be suspended in phases 1 through 3. Phases 4 and 5, and again we're in phase 4, meals will be served in classrooms and or common areas when space allows for social distancing and staggered times in the use of disposable utensils. PPE, face masks, shields, gloves, and hand washing and hand sanitizer is required of all staff and students. Cleaning, sanitizing, barrier protections will be used where necessary. Extracurricular activities will be made on a case-by-case basis. Field trips that require transportation to indoor facilities are suspended for the year. Recess is held outside when possible in cohorts. Extracurricular access on an individual basis. Phase 6, return to normal food service, inter-school, and after-school activities. School athletics. Phase 1 through 3, all athletics would be suspended under the Michigan High School Athletic Association protocols. Again, we're in phase 4. In phases 4 and 5, all athletes and coaches must be health screened and recorded before each practice and competition. Equipment is sanitized before each practice and competition. Coaches wear masks at all time. Athletes wear masks. All athletic programs will follow the Michigan High School Athletic Association and state guidelines for athletic competition. All athletes and coaches will maintain social distancing when possible. In phase 6, all athletics return to normal with unlimited spectators at events. Transportation. Phases 1 through 3, there are no transportation. Phases 4 and 5, PPE, face masks, and hand sanitizing required of drivers, monitors, and students. Cleaning and sanitizing, buses cleaned and disinfected before and after every route. Plans for students not allowed to ride the bus due to illness or other. We keep windows open, weather permitting, when vehicle is in motion. Space students out as much as possible, no more than 2 to a seat. Phase 6, we return to normal transportation. You can see on the right, wear a mask, face mask, thank you, and you can see the hand sanitizers that are on all of our buses. On the bus, for students receiving bus service, the commitment to health and safety for in-person learning starts and ends each day at the bus stop. Prior to entering the bus, students will need to use hand sanitizer provided by the district and wear face coverings. The students should look to their driver for instruction on proper seating and distancing while on the bus and the process for exiting the bus at arrival at school. Before and after each run, buses will be cleaned and disinfected, including frequently touched surfaces and any specialized equipment students may need to ride the bus safely. If weather permits, the windows will be open to allow air to thoroughly circulate.